I'm Cully Carson, professor of urology at the University of North Carolina in Chapel Hill, North Carolina, United States of America. Erectile dysfunction is a common complaint amongst men. Indeed, of men over 50, more than 50%, more than half have some complaints of erectile dysfunction. And that erectile dysfunction causes significant problems with themselves, with their sense of manhood, and also their relationships with their partners or significant others. So it's something that's worth treating, it's worth identifying. The most difficult thing is actually identifying it, and it really should be an important part of the history that one takes in any man that comes for medical treatment. All it takes is one question: are you having trouble with erectile function? And why is that important? Well, number one is we can treat it now easily with some of the PDE5 inhibitor drugs that have been around since the 1990s. But even more important than that, it can be the first sign, the canary in the coal mine, so to speak, of cardiovascular disease. Indeed, a number of studies have shown that if a man complains of erectile dysfunction, within 3 to 5 years, he's at very high risk for a cardiac event. Cardiac event meaning a myocardial infarction, a stroke, or some other cardiac event. So asking him, identifying that erectile dysfunction early, and then not only treating the erectile dysfunction, but also screening him for the vascular disease, the cardiac disease that may go along with that erectile dysfunction. And in fact, men as young as in their 30s that present with erectile dysfunction, one can intervene very, very appropriately by asking them to stop smoking, lose weight, check their cholesterol. If they're having difficulties with exercise, have them screened for cardiac disease early. And by that method, you can use erectile dysfunction as the canary in the coal mine, identify men at risk, at high risk, for cardiovascular disease, and intervene not only in their social life, but also in their life in general.